Hey guys, Jim here. Welcome back to our Echocardiography Registry review. Feel free to pause the video after I ask the question, give enough time to answer it before I answer it. Let's dive right back into this thing. Question 127. What is demonstrated in this echocardiogram? A, VSD, B, false aneurysm, C, true aneurysm, or is it D, dissection? The answer is A, VSD or ventricular septal defect, and this is caused by a post-myocardial infarction. Question 128. Drag and drop the letter X on the thoracic aorta in this patient with a persistent left superior vena cava. The answer is right here. That's the thoracic aorta. So I'll just put my X right there. And this image was obtained by tilting your transducer posteriorly. That way you can see the dilated coronary sinus in the long axis view. This is the right atrium, right ventricle, and left ventricle. Question 129. A flat posterior wall in diastole is associated with what? A, right ventricular pressure overload, B, constrictive pericarditis, C, tamponade, or is it D, right ventricular volume overload? The answer is B, constrictive pericarditis. Question 130. Click in the area where velocity increases during inspiration in this patient. This patient has a large circumferential pericardial effusion, which most likely is causing tamponade. When this patient breathes in, the tricuspid valve inflow velocity will increase. This is the right side of the heart, that's the tricuspid valve, so the inflow will be right here, and this is where the velocities will increase during inspiration. Question 131. When a patient with tamponade breathes out, A, ventricular septum moves towards the posterior wall, B, ventricular septum moves towards the RV free wall, C, ventricular septum moves caudally, or is it D, ventricular septum moves cranially? The answer is B. The ventricular septum moves towards the RV free wall. Question 132. What does this image demonstrate? A. Non-compaction cardiomyopathy. B. Concentric hypertrophic cardiomyopathy. C. Apical hypertrophic cardiomyopathy. Or is it D. Asymmetric hypertrophic cardiomyopathy? The answer is C. Apical hypertrophic cardiomyopathy. Question 133. What type of VSD will cause aortic regurgitation? A. Perimembranous. B. Supracrystal. C. Infracrystal. Or D. Trabecular? The answer is B. Supracrystal. Question 134. Click on the IVC. The answer is right in this region here. This is the RA-RV inflow, or the RVIT. This is the right atrium, and this is the right ventricle. The superior vena cava would be over in this region here, and that's the tricuspid valve. Question 135. When a patient with constrictive pericarditis breathes out, A. Hepatic vein flow reversal decreases. B. Hepatic vein flow reversal increases. C. Hepatic vein blood flow increases. Or is it D. Hepatic artery blood flow increases? The answer is B. Hepatic vein flow reversal increases. Question 136. This person has suffered a contusion from a bullet, which most likely entered through which part of the heart first? A. Left ventricle. B. Right atrium. C. Left atrium. Or is it D. Right ventricle? The answer is D. Right ventricle. Question 137. When a patient with constrictive pericarditis breathes out, A. Ventricular septum moves towards the posterior wall. B, ventricular septum moves towards the RV free wall? C, ventricular septum moves caudally? Or is it D, ventricular septum moves cranially? The answer is B, ventricular septum moves towards the RV free wall. Question 138. Which tumor will invade the veins, draining the kidneys? A, angiosarcoma, B, hemangioma, C, renal cell carcinoma, or is it D, rhabdomyosarcoma? The answer is C, renal cell carcinoma. Question 139. Click on the posterior tricuspid leaflet. The answer is right here. This is the posterior tricuspid leaflet, and this is the anterior tricuspid leaflet. Question 140. When a patient with tamponade breathes in, A, ventricular septum moves to the right, B, ventricular septum moves to the left, C, ventricular septum moves anteriorly, or is it D, ventricular septum moves superiorly? The answer is B, the ventricular septum moves to the left. Question 141. What does this echocardiogram show, and how was the image on the far right obtained? A, dilated cardiomyopathy and CT. B, apical hypertrophic cardiomyopathy and angiography. C, non-compaction cardiomyopathy and contrast. Or is it D, concentric remodeling and bubble study? The answer is C, non-compaction cardiomyopathy, and this is contrast. It could either be Optison, Definity, or Lumison. Question 142. What type of VSD is located at 12 o'clock? A, infracrystal, B, supracrystal, C, perimembranous, or D, inlet? The answer is B, supercritical. Question 143. What does this image represent in a non-febrile patient who has an elevated white blood cell count? A, papillary fibroelastoma, B, vegetation, C, thrombus, or is it D, merantic endocarditis? The answer is A, papillary fibroelastoma. And on this image, the tumor is right there. Don't get that confused with this. This is your pap muscle and your chordae tendineae, your mitral valve. This is your anterior mitral valve. Posterior mitral valve is here. This is your aortic valve here. This is your non-coronary cusp, and this is your right coronary cusp. This is your anterior ventricular septum, and this is your posterior wall or your inferior lateral wall. Question 144. Epstein's anomaly is categorized as having what? A, mitral valve displaced more inferior than the tricuspid valve. B, overriding aorta. C, atrialized right ventricle. Or is it D, cleft mitral valve? The answer is C, atrialized right ventricle. Question 145. When a patient with constrictive pericarditis breathes out, A, hepatic vein blood flow decreases. B, hepatic vein blood flow increases. C, hepatic artery blood flow decreases. Or is it D, hepatic artery blood flow increases? The answer is A, hepatic vein blood flow decreases. Question 146. What does this echocardiogram demonstrate? A, angiosarcoma. B, myxoma. C, rhabdomyoma. Or D, lipoma? The answer is A, angiosarcoma, and these types of tumors are typically found on or in the right atrium. Question 147. Epstein's anomaly is diagnosed when the tricuspid valve is displaced how far from the mitral valve? A, 10 centimeters, B, 10 millimeters, C, 1 millimeter, or is it D, 5 centimeters? The answer is B, 10 millimeters. Question 148. Which chamber will dilate first as a result of this echocardiographic finding? A, left atrium, B, left ventricle, C, right ventricle, or D, right atrium? The answer is C, right ventricle. When you have severe MR, the MR will back up into the left atrium and into the lungs, then into the right side. So the right side will dilate first, then everything distal from there will start to dilate. And that concludes all the questions for this video. I'll hurry and write more questions and I'll upload that as fast as I can. If any of you have any questions about your upcoming echo boards, feel free to email me at ultrasoundboardreview@gmail.com, or you can proceed text or call at 435-922-1635. If any of you need any mock exams to purchase, you can subscribe to our mock exams on our website, ultrasoundboardreview.com, and you can start preparing for your boards there. If you need more of a one-on-one echocardiography tutoring, you can subscribe to our tutoring session on our website as well. I'm Jim with ultrasoundboardreview.com. We'll see you next time.